I think this is important, that sepsis can kill someone in the prime of their life if an infection sparks that cascade. Moving on to the death of the race car driver Kyle Busch. It turns out now that he likely had fulminant pneumonia progressing to sepsis. This is something I've talked about before, that certain infections can spark a dysregulated immune response in somebody and become life-threatening, cause multiple organ failure, and that seems to be what happened. We have no clue yet to what organism caused this. I'm sure his doctors do, but that hasn't been reported publicly. We know sinus infection, we know pneumonia, we know cough, we know coughing up blood, we know that he died from sepsis. And I think this is important, that sepsis can kill someone in the prime of their life if an infection sparks that cascade. That's why it's so important to identify someone who's at risk for sepsis. And I've talked about that before, that we're trying to come up with tools using artificial intelligence to try and look at clinical factors, to look at blood work, look at vital sign patterns, and figure that out. In that vein, I also read something about children with acute lymphoblastic leukemia, trying to develop tools to identify which one of those individuals is going to become sepsis. There's children that are that are very sick with leukemia, and I think it's hard to do. And this is one of the problems that Kyle Busch's death kind of illustrates, is that you don't necessarily know who is going to develop sepsis. And that's kind of one of the major tasks, is using precision medicine to say, this person's upper respiratory tract infection is likely not to progress, while this one is going to get in trouble and end up septic. That I think is what we're trying to figure out.